The following portion of KTAB for You is sponsored by Maichel Retirement Solutions.
Medicare is complicated, and that's why you want to make sure you have an expert in your corner when you need it. Luckily, we have licensed Medicare specialist Brianna Maichel with us here today. Brianna, how are you doing?
I'm good. How are you?
I'm doing well. So I'm glad to have you here. This month we have a mixed bag of questions, if you will.
Yes.
First off, tell me a little bit, where does someone need to go to create a Medicare account?
Yeah, so once you have your Medicare card, you can actually go on to Medicare.gov, and on Medicare.gov it will allow you to create an account, and that really is going to be the portal for all healthcare related benefits. It will tell you what you're enrolled in, so a lot of the times we have people come to us and they'll say, hey, I'm not sure what I'm enrolled in. Medicare tracks that enrollment, and you'll be able to see it on your Medicare.gov account if you create one. One of the common mistakes that we see people make when they go to try and create a Medicare.gov account, a little tip, is it will ask you for your Medicare number and then your Part A effective date. And a lot of people, they think they can't create an account for some reason, but it's really because they're entering a date of birth into that spot instead of their Part A effective date. So you just need your Medicare number, your Part A effective date, and an email address, and you can create a Medicare.gov account and track all things Medicare. Explanation of benefits, your enrollment status, you can pay your Medicare bill in there. It's a good thing to have.
Now, one thing a lot of people do when they retire is, they're traveling. They're doing the things they couldn't do when they were working. So, if someone's traveling, does their Medicare plan work as they're traveling around the country?
That's a really good question that we hear a lot. So it really is going to be plan specific. It depends on the plan that they're enrolled in. We tell people that technically, Medicare does not cover outside of the U.S. except for limited coverage near the U.S. border. Now, with that said, on some of your Medicare supplements, they will have some foreign travel emergency benefit, and then on some of your Medicare Advantage plans, they will have an emergency benefit. But just to be safe, we always tell somebody you really should, if you're going to be traveling outside of the United States, have some type of travel health insurance, which is fairly affordable. It's pretty inexpensive. If you're planning on going on that trip, I would just consider it an expense when you're on Medicare.
Something kind of in the same vein, if someone's moving to another state, what does that do to your Medicare plan?
So whenever you move from one area to another area, because a lot of these plans are based on your zip code, you would actually get what we call a special election period to be able to choose a new health plan in the area that you move to. So what we usually tell people is get moved, change your address, and then let's find you a new plan.
Now, is your annual wellness checkup, is that covered by Medicare?
It is. So every year Medicare will have you do a wellness check with your primary care physician, and then they're the ones that are really determining what type of other preventative benefits that you might need to use, like your colonoscopies and your mammograms and your cardiovascular health screenings. They're really going to be that first point of contact. So yes, Medicare will cover that wellness visit once a year.
Now, this is a new term I've learned today, the Medicare penalty box. So what is that?
The Medicare penalty box. This is, and I'm just going to give you an example as well today. If somebody were to choose not to take Medicare at 65 and they didn't have creditable coverage, they'll start to assess a penalty. Now that penalty for Part B is 10% per year that they choose not to take it. So actually during annual enrollment, I had a woman come to me and she was 75 years old and she had never taken Medicare before. And her children said, Mom, it's time, you need some health insurance. And so when I talked to her, I described to her what that penalty would look like because she had not taken Medicare at 65 and she didn't have any other health coverage. So she actually was going to have to pay a 100% because it was 10 years. So they take 10% and they multiply it by how many years that you didn't have it, which 10 times 10 is 100. So 100% penalty on top of the current premium. So with the current premium being $185, she was basically going to have to pay that 185 plus 185 every single month for the rest of her life. And as that premium increases, so will her penalty because it's based on a percentage.
That's definitely something we want to avoid. So we want to get in with you and make sure we get all the help you need. So, what does it cost to get your help for these?
Good question. And everybody asks me that. My charges are of no cost to the beneficiary. So all they have to do is call, email, go to our website, schedule an appointment, or attend one of our free Medicare courses, and we'd be happy to help anybody that needs our assistance.
Brianna, thank you so much for coming today.
Thank you for having me.
If you would like to contact Maichel Retirement Solutions, they are located at 2500 South Willis in Suite 200. They are open Monday through Thursday from 9 to 5 and Fridays from 9 to noon. And a reminder, Brianna hosts free Medicare classes at the Abilene Public Library South Branch in the Mall of Abilene on the first Thursday of every month at noon. We'll have all of those details and how to contact her on our website, bigcountryhomepage.com.
The preceding portion of KTAB for You is sponsored by Maichel Retirement Solutions.